Hello and welcome to the International Critical Incident Stress Foundation's CISM Live Series, where we connect with critical incident stress management subject matter experts live on YouTube. My name is Kelly and I'm the host of the CISM Live Series. If you enjoy the content being shared today, please consider giving this video a like and leave a comment under the description. Today we're joined by guest speakers, Teahen and Rima Afifi. Teahen is a funeral director, author, mental health professional. He authored Mass Fatalities, Managing the Community Response, and co-authored and contributed to published articles including disaster, climate change, and public health, building socio-economical resilience, disaster mental health counseling, a guide to preparing and responding, ethical guidelines for mass trauma and complex humanitarian emergencies, and psychosocial program for humanitarian and aid workers on the front line of conflict. Rima Afifi is a professor in the Department of Community and Behavioral Health, College of Public Health, University of Iowa. Her research and practice focus on mental health, refugee and immigrant well-being, tobacco control, and intervention evaluation. Rima engages in public health research and practice with intent to promote social, community, and policy environments conducive to well-being. Welcome, Peter and Rima.
Thank you for having us.
So today we're actually going to be getting a World Congress 16 presentation preview of your presentation titled Fatalities Management Workers and COVID-19, Stress, Coping, and Well-Being. So your study is focused on fatality management workers or last responders. Who are included in that classification of last responders?
Well, when we set up the research, we wanted to look at those individuals who were caring for the dead and the families of the dead that were especially of the COVID-19 pandemic. And so it really encompasses anyone who works, for instance, in a hospital morgue, to the medical examiner, coroner, funeral home, funeral directors, crematory operators, and cemetery operators and their staff. So it's both, could be both professionally licensed individuals plus all their support staff. We did not get into clergy. We've had some discussion about whether clergy should be scheduled, could be involved in a study, and it's and the EMS type of responder, because they're already involved in a lot of studies. The paramedics and the people who are running with the ambulances. So this is focused just primarily those who are connected to the dead and the families of the caring for the families of the dead.
And that's quite a few professions and staff that often you don't really think about behind the scenes, almost, so to speak, right?
Well, it's one of the things that I learned over the years is no one's talked about it. Mm-hmm. There's and that was kind of the impetus of this whole study was, as a funeral director, and I own and operate a funeral home in Cedar Rapids. As a funeral director, and in the research and the writings that I've done, I've looked for research that has been done on this category, on this grouping, and there just isn't. And that was when pandemic started, I said, this is the perfect opportunity to study this group and the impact, because at that point we anticipated there was going to be more than 3 million dead here in the United States and millions in the world. So I knew it was going to have a severe impact on the professional groups of caring for the dead. And so when I started putting the plan together, people were kind of denying the fact of, well, no, they've got to have been studied. We our funding source is coming from the Department of Health and Human Services, and Rachel Call, who is well, has a long history of with ICISF. I called Rachel up and I said, "Hey, Rachel, we need to study this group." And I said, "There's never been a study done on it." And she said, "Oh, there's got to be a study done on it. Let me look into it." She called a couple of weeks later and said, "There's never been a study on this group." That's incredible to believe. And then I was lucky enough to run in, to have Rima and her research team at the University of Iowa College of Public Health involved. And it was the same discussion, just a total disbelief that a group of professional responders or a group of people responding to a real taboo subject of death and dying and grief and things that a lot of people don't want to talk about, that it's just been completely ignored. And I think that's really why there's so much excitement. We found a group of people that that are so critical to the well-being and really the long-term health of the mental health of the world, the country. And no one's ever talked about what they do, how they do it, and what's the impact of this. And Rima, I know you and I talked about it, your response, and share what you thought on that.
Yeah, thanks, Peter, for just sharing all that, because it's absolutely what happened. So Peter first reached out to us, and I think February or March of 2020, with this idea of, and I think, Peter, as you mentioned, Kelly, in your introduction, Peter has been involved in many, many, many emergency situations across the world in support of, the work that he does and mental health. And when he reached out, he was basically sort of feeling like he was going to see very similar conditions as a result of COVID, particularly for last responders or fatality management workers. And we started to talk, and he said, well, part of it is that we are an occupational category that is, like, in a sense, stigmatized or discriminated against. Nobody really thinks about us. And I felt really bad because I hadn't. And, in public health, we're always sort of thinking about who is being left out of the picture and trying to bring people that are left out of the picture into the picture. And I felt like, I had been caught sort of not thinking about a particular occupational group, and of course, not on purpose, but just it's not, as Peter said, our societal response to death and dying is to not talk about it because it's painful and we just don't want to deal with it. And part of that not talking about it is sort of interacting with occupational groups like last responders only for the small time that we absolutely need them. And we so value, their work at that time, but then they're sort of out of our thinking and psyche. And so that just got me even more interested in doing this work. And there's so much that's going on here that we don't know about, don't understand, and it's both sort of supporting the fatality management workers and the last responders, but also starting to change the narrative about the work that they do with the general public. And I think those are the two overall objectives that we hope come out of this particular work.
And somehow, the crematory folks, why the cemetery folks, and the investigators, and it really is the system of fatality management. All those pieces are involved. If the hospitals get backed up, which we've seen in New York and LA and other areas, they bring in semi trucks because they can't process the dead fast enough. And oftentimes that's putting a huge burden on the staff of the hospitals as well as the families who are not able to claim their loved ones. If the funeral directors get involved, and we get overwhelmed because it's obviously a mass fatality situation, which is overwhelming the normal resources of a community, and any one of these parties can get COVID and get knocked out of the equation, it knocks the whole support system down. And then, when you get into, okay, the funeral directors and the medical examiners can handle it, but you've got to include the cemeterians and the crematory operators, because if they fail, everything backs up. And we've been very lucky in this response that there's been instances of collapse of operational support simply because of the immensity of the death toll. And we're watching it again. I was reading things in India going on right now that is just it's becoming it's becoming an emotional as well as a physical crisis over there of the living, simply of what's happening And so that's why everyone involved in this study plays a key role from death until disposition of the dead. And without any one of the players, the system would fail. And we need to make sure that they're healthy, both physically and of course with the principles of ICISF and others, that hopefully we can make sure that their well-being is cared for now as well as in the long term.
Yeah, so we've kind of touched upon why this study is so important, because these last responders are not often thought of as crisis responders,
Right.
Even on the media.
Mhm.
So how did this project, can you give me a little bit of background on how this project started?
Well, it's from the historical perspective, over the years, I've done 32 years of disaster work, and as a funeral director, I've been involved, but also involved in other responsibilities. And I've often thought, when I do the research, I saw there's just no research out of it. And in the disaster response, it's interesting. A lot of the disasters will have like an event at the end of the work, the working to do the initial response or begin the recovery phase of a disaster, or later, maybe for a year later, they'll have a 1-year anniversary. And it was very striking, and it was what Rima alluded to, that everyone was usually involved to this recognition or this celebration, and it was rare, if ever, that fatality management workers were involved, and yet they played very, very key role in all these disasters. And that, when you talk to professionals in this category, a lot of them just felt discriminated against. They felt ignored. They felt underappreciated. They were kind of felt, well, you're not, thanks for your work, but it really isn't worth being recognized. And it was creating a lot of, I think, long-term emotional stress on these workers that were feeling unrecognized, undervalued, unappreciated. They know they did incredible work in a very stressful situation. They kind of said, I guess nobody cares. And so it was, I was always looking for an opportunity where you could have clearly a study with an impact. So often when it's an instantaneous disaster, an airplane goes down or something, everything's engaged. You're talking about a limited number of people. The pandemic just opened up a whole opportunity that we haven't seen in a very long time, where it would impact, in our situation in the study, a nationwide impact of all these workers over a time span that we could, have a clear time to set up the study and implement it and do the long-term study of and gathering of information. And so it was with that impetus that, when it became time, last February or March, I said, I need to move this forward. It's always like a dream. When I'm doing the research and the writing, I said, someday we need to study this group. And it just hit me that, this thing is going to last 5-6 months. We're going to be able to get the study done now, and it's going to be over with in June or July. And, we'll have a certain period. Never imagining that we'd be talking about or still having an impact on society, 18 months later. So that's when we started making the calls and trying to stir up interest. And what was really moving to me in a way was whoever I called and raised the subject, they were fascinated by it. And they said, they've got to be steady. And it wasn't, oh, this is just another study. There was sincere interest, and kind of like what Rima was saying, they never thought of this group, and people were almost ashamed that they had never thought about this group before. And the excitement rose. And the more calls I made, the more interest it stirred. And they say, I know somebody who can help, or I know this group. And I think Rima and I continue to see that as we put this research program together, that when we call and ask for input or ask for help, it's rare when people say, no, we're not interested. I don't see the relevance of it. They're on full board, and we'll talk later, I'm sure, about the advisory board that Rima's put together. And so, you know, we got DHHS was involved with, you know, starting the initial and starting the trying to identify where funding was going to come from. We needed a research team, so I'm on adjunct faculty for the University of Iowa, but now with the College of Public Health, though I lecture at least once or twice a year at the College of Public Health. And so I reached over there saying this is appropriate for public health. They put me in charge of Rima, not in charge of Rima. They connected me with Rima, and we've been doing this all virtual. Yesterday, we did a meeting, presentation. That was second time in the last 2 weeks over, you know, all this time we've been doing it Zoom. So it's been kind of fun the last 2 weeks to actually sit across the table, work it all out. And it's a partnership that's just amazing.
Well, that brings me to my next question then, Dr. Rima. What motivated you to become the lead researcher for this study, and kind of walk us through the methodology used throughout this study?
Thanks, Kelly, and please just feel free to call me Rima. Yeah, I mean, I think I said a little bit why I was interested. It was just one of those sort of aha moments when there's a whole occupational category that I hadn't even thought about. And the more that I talked to Peter and you know, then I started to read about fatality management workers and last responders, and it was mostly things that I could find here and there in the media. And there's a little bit written, as Peter says, but not enough. And I started to hear stories about about the stigma and discrimination. And again, that's an area that public health often focuses on, like, you know, we would love to eliminate discrimination for anybody. And so even early on in the media, you were hearing these stories of last responders saying, you know, in New York, for example, where first responders, very rightfully so, you know, I think nobody can deny the amazing work of first responders, were, you know, given free meals, and there was a lot of support to first responders. And then the last responders would come to try to get those also, you know, that support, and they would be refused. They would be refused free meals because nobody understood the amazing and really important work that they themselves were doing as well. And you just started to hear that more and more, and that drew me in even more. Like, there's something that we need to change about this picture. And so Peter and I think from the beginning have thought about the fact that the stories are really important to bring out. And we will be doing interviews, and we can talk about that later, to uplift the stories, because I think people understand stories more than they understand numbers. But because there was so little out there to even base anything on, we decided to first start with a survey. Also because when we started, and I mean, it continues to be this way, but COVID was really taking over. And we wanted to provide something that people could do on their own time, you know, on a computer. Like, you didn't have to talk to me and set up a meeting with me and, you know, to do an interview. Here was a link. When you're ready, you know, go do it. We thought that was just much more manageable at the time that we were in with COVID. And so we set about just developing a survey, and relying, of course, on you know, scales that had been tested and were solid, you know, robust scales to measure stress, coping, and well-being is what we were trying to get at. Like, what is the stress level? How are people coping? How is that affecting their mental health? And we used both a sort of a positive mental health measure, which is the WHO 5, and a more, I don't know if I want to say negative, but like an anxiety measure of mental health. So those are our two sort of well-being outcomes. And of course, added a whole bunch of COVID-related questions, and added sociodemographics. Now, under each of those buckets, it was through talking with Peter and other, you know, last responders that we started to recognize what to put in there. So we have measures, regular measures of stress, but then we have compassion satisfaction, compassion fatigue, burnout, you know, those things that are really common in this space, which I probably wouldn't have known to put in there. And I think that's what's really important about a partnership like this, or any research partnership, is that I bring in particular skills that might be methodological, but I don't know the occupation. And without Peter and the group of fatality management workers that we're now working with, First, I would probably create tools that were not necessarily relevant or appropriate or effective. And second, I might interpret results in a way that wasn't appropriate. So it's the partnership, I think, sort of in a community engaged approach, right? The partnership between researchers and practitioners on the ground in any field that really make research strong and relevant to communities and the ability to make change. So we developed that survey, and again, with Peter's guidance, reached out to associations of last responders, and we had 9 associations say, we sent out to more than 9, but 9 at the time said that they were willing to send it out to their membership. So again, research, there's a lot of ethical considerations in all research, and so of course our research was approved by our institutional review board. But part of those ethical considerations is that, I don't need to have access to names and, emails. That's not, that's inappropriate. And so what we did is we just basically sent a letter to the president or executive director of the association, and they sent it out to their membership. So there was no direct link between myself and any of the members. And then we sent 2 reminders. So there was about 3 weeks that people had to respond to the survey, and we sent it out mid-July, closed it at the end of September, and Peter can talk a little about our response. And basically it was a long survey. It was about 35 minutes long. And then at the end, we asked if people were willing to be interviewed or willing to take a follow-up survey, and we can talk about that later. And if they did, then they sort of closed that survey down. So that survey remains anonymous. We have no identifying information on that survey. But it took them to a separate survey where they could put in their name, number, and contact information only, so that we could recontact them at the time of the interview or next survey. And that's okay ethically, because they have given us permission to do that. So again, I just want to make sure that this was done with the IRB and in all of the ethical considerations of research.
Of course, and I appreciate you kind of going through those steps for sure. So how you kind of talked about the comprehensiveness of the study. What would be the next phases of the study?
Well,
Peter, do you want to?
Yeah, I want to up for a second. We just looking at, if we're talking to a group that has never been asked their opinion before, and never, how are you doing, and how are you coping with this? You kind of wonder how many are going to take the time to do this 35-minute survey that Rima's talking about, and be willing to invest that time into being part of a project. And if, there's a lot of folks with ICISF do research, and you kind of know that you're putting out probably thousands of these surveys blindly out through the associations. We have no idea exactly how many went out. All we know is what we got back. And Rima set me up early on. She said, with a study of this size and with this type of group that's never been studied before, expectations were kind of at, well, if we get 200 responding to the survey, we consider it, the good numbers, the good response. Mm-hmm. And 200, I said, wow, that just doesn't seem like it. And then, the phase that we'll talk about next, that Rima will talk about next, is the oral phase, where people have said, I'm willing to be interviewed by someone to go deeper into the subject. They were hoping to get 20 who'd be willing to be part of that process. And then another phase of it would be, we did a survey in the beginning last summer, and when COVID is over with or to wrap up, we asked people, would you be willing to take this survey again? And again, how big of a number? And they said, well, probably a small number of that 200 group. We were blown away, at least I was, and I think Rima would too. We had over 700 and some responses. Now, some of those we did not incorporate into the final study simply because they were not complete. Mm-hmm. But completed responses of people who wanted to participate in the study is 535 people, when we were hoping to get 200. When we're looking at the study and hoping that 20 people would find this interesting enough to be able to do an oral interview.
Mhm.
And we have 130 people that want to be part of the oral interview project. And I think almost half of the people who responded to the first survey are saying, we want to be part of the second survey. And so everybody from the research team, government partners, and the advisory board that we have, are just blown away that they know that there's a lot of hurt out there. They know there's a lot of interest out here simply by the overwhelming response that we've got from the study so far. And Rima and I were doing a presentation yesterday, and face-to-face presentation, and we were moved by the fact that there was a gentleman, a fatality management worker there, that elderly gentleman that's retired, came up to us twice crying, with tears in his eyes, barely able to talk, thanking us for finally asking fatality management workers how they're doing, and how is this impacting them. He said, in my career, no one's ever asked. He said, this work is so important. And I know, I was moved by it, and really emphasized the work that this research team is doing is so badly needed. And so when we're now entering into the second phase of the project, and Rima, tell us about the oral interviews.
Yeah. So, I mean, I think two things. The other issue to remember is about the numbers, and our lower expectation was this was at a time when we know that last responders were really like overburdened by the number of COVID deaths, in addition to the regular, deaths that happen, usually. And so, seeing the response, despite the fact that everybody was very overburdened at that time and continues to be, I must say, that even was more of an indication of how important this was and how much it was giving a voice to a group that hadn't really been given a voice before. There's something else I wanted to say before I go into it'll come back. From the beginning, I think we were very clear that this work isn't research for research's sake, because that wouldn't be helpful at all. So the whole intent of our work from the beginning has been that this research provides information that can be used to create environments that are more supportive of health and well-being of last responders. And so we've had that in our minds as we've gone forward. So what do we need to understand to be able to develop programs or interventions that support these workers in the job that they do daily, with or without COVID? It's stressful. I mean, as Peter said, COVID sort of provided I hate to say an opportunity, but provided a space where perhaps the issues became much more salient. But last responders are continuously faced with some difficult situations in their work, and there is a lot of stress related to that, and a lot of joy, I must say. And I hope we get to talk about that as well, and why they choose to go into a profession, and what gives them compassion and satisfaction in that profession, because we definitely saw that. So then, go ahead, Peter.
Right. Another thing that I think is an important piece of the study is a lot of the fatality management workers are small businesses. When we're talking EMS or police or fire, we're talking large organizations. When we're talking even teachers now, we're ICISF, we've done support for response team for the teachers out there and the different groups. This is a unique group, is that only 10% of, for instance, funeral homes in the United States are corporately owned. 89% are individually or family-owned operations who have so much less support, so much less community access, because it's you're a small business, you don't know where to turn to. And that's where, we'll talk later more where ICSF membership can help, because these men and women in these fields, cemeterians or crematories, funeral homes, and investigators have all said, I've felt alone. I didn't know who to turn to. And that's why I think this next phase Rima's going to talk about, the oral interviews, is going to open up an incredible opportunity to hear their words and see how this is impacting them.
Yeah. So the next phase is to go to interviews, and we're starting that hopefully within the next month. We're in the last phase of the IRB process to make sure that, again, we're being ethical in all of the considerations related to the interviews. And we will be reaching out to those who have given us permission to call them back to talk to them and hear the stories. And again, like I said, I think the stories resonate a lot. And we heard even yesterday, part of what we were presenting and also having a discussion with the group we were presenting to yesterday, who were all last responders. And I mean, their stories were, just so touching, both in terms of the stress, but also in terms of the coping and how they managed, and how they were able to stay true to the values that they bring to this profession. And there's a lot of value-driven work that happens in this profession. So we're doing those, and then we are going to be doing a follow-up survey to try to see change between last summer and this summer in terms of people's responses. And again, those will be linked in that people that gave us permission to recontact them for the second, we can recontact. Again, without names, there's a code on each of the surveys, and it's the same code, and they know the code, I don't, and so they can, that's how we connect the two surveys.
Gotcha, that's an important thing to note for sure. Thank you. So what have you guys learned from the study so far, and how will this information be used?
Rima?
Okay, so we've learned a lot. And there's so when we start off doing analysis, we usually do various kinds of analysis. And the first things that we look at is generally like what's happening to the whole group. So of the 535 that responded, how are they reacting, or how are they responding to the instrument, or to the survey, to the questions. And so we've seen that there's quite a bit of stress and anxiety in the respondents, in the last responders, but at the same time there's a lot of compassion, satisfaction, so that's interesting. And there's a lot of these dichotomies where you see the stress of the work, and at the same time you see what keeps people in the job, what brings them joy in this job. And even that part, so compassion, satisfaction is, what gives me pleasure in the work that I do, what gives me purpose in the work that I do. And Peter can speak to this better than I, but I've learned a lot that part of what gives them pleasure, other than making sure that they are respectfully, creating a safe and respectful way to take care of our loved ones after they pass, is the interaction with families, and that is part of the real joy in this work. Creating a place where families can really feel like at a time that's very difficult, feel supported, feel community, and so even though there is a lot of compassion, satisfaction related to that, it's also been one of the really hard things about COVID, because that part, fatality management workers haven't been able to do as much as they love to do. So there's a lot of very interesting dichotomies, which I think the interviews will bring out very clearly, but that we're already seeing. So there was a lot of that, sort of frequencies across all of the 535. What did we see? And we can talk a little bit about the piece on discrimination later, because that also came out. But then we started to look at what we call bivariates, which is interactions between particular scales or measures and sociodemographics. And what we found there was that those respondents that identified as female had much more negative outcomes on almost any measure. So had more stress, more anxiety, less well-being, more fatigue, compassion fatigue, more burnout than those that identify as males. And that those respondents that were younger, so 20 to 40 mostly, perhaps 20 to 50. But it was interesting because it was in terms of epidemiology, it was a beautiful figure, because every single 10 age bracket got worse. So it was like and so they were also having much more negative outcomes. So the younger the respondent was, the worse the anxiety, the worse the stress, and the worse the well-being. And so that has also gotten us to start thinking about and talking about the implications. What does this mean? Why did it happen? Why is it harder? And there's a lot of interesting, I think, suggestions that we can make. The other thing that we saw is, as I said, we had a bunch of COVID questions, and some of them were, do you feel like you can protect yourself from COVID? Do you think that you can protect your family from COVID? And how much did COVID affect your life? We also found that those 3 COVID questions were very much linked to people's well-being. So the less they felt they had control over protecting themselves from COVID and protecting their families from COVID, the more anxiety they had, the more stress, and the less well-being. And the more that they thought that COVID had really affected their lives, also, the worse the outcomes were. So those are some of the preliminary results that we're starting to see. Do you want to add, Peter?
Yeah, I think well, we mentioned the discrimination, and we alluded to that earlier. You know, the discrimination against this group of professionals, or group of fatality work management workers, came from even the basic essentials of getting PPE. You know, where they were told, well, what do you need it for? Getting the vaccinations. A lot of them were, you know, said, you know, we were under the CDC, this classification was classified as 1A. And yet when people were trying to get the vaccines, they said, well, what do you need it for? And we're oftentimes turned away. So it's that minimalization of that put them at risk even more, because they weren't getting the equipment they needed, the support they needed from, you know, getting protective equipment, but they even do the vaccines. And as I alluded earlier in the presentation, you know, this chain of events from death till disposition is critical for the well-being of our countries, both physically as well as emotionally. And the care providers were being discriminated and say, you know, what do you need it for? I think just getting the facts out to them is so critical that it is you know, it has hurt a lot of the responders who just kind of, you know, can't, you know, just get tired of, you know, this compassion fatigue is just overwhelming them. And you know, we looked at the numbers in the study of the compassion fatigue, and it's impactful. And you're already in a profession that is having a problem drawing enough people into the profession. And I think we looked at what 50% of the people are saying that they're looking at, or 25% of the people are saying they're looking at leaving the
changing jobs.
And that is just going to put this whole fatality management workforce in major jeopardy, probably over the next few years, as people just say, I can't take it. I've had 2 employees myself, students who were in mortuary school, that left because they never thought they'd ever have to deal with pandemic. And, you know, they were younger and they just didn't want to expose themselves or their families to it. And they left. And that, you know, really is going to have a broad sweeping impact on this profession, and emphasizes even more why we need to create programs afterwards for this professional group, and why we need to turn to groups like ICISF and others to help us use your resources to get support finally to this group of people that for, you know, forever have basically been ignored. So those results, we'll go into more detail at the Congress on the results and show all the graph and the charts and the numbers. But yeah, I think they're really revealing. I think that, you know, add to this, add the numbers that as they're being interpreted and presented, that the research team is doing such an incredible job at, is going to create a very healthy discussion, hopefully. And the oral interviews will simply add, you know, strength to that documentation to say, you know, the emotional well-being out there of fatality management workers is needs to be attended to for the well-being of everyone involved.
So once the study is complete, then what do you plan on doing with the information that's gathered?
So I think this might get us to, it's a good time to talk about the advisory committee. And so similar to what I was saying earlier, in terms of a community engaged approach, very early on, we create, I don't know if created is the right word, we established an advisory board, and it's composed of fatality management workers. So the organizations that sent out the survey were invited to join the advisory board, representatives from the organization, and then the research team. And that's been invaluable in helping us to understand where to go next, helping us to understand what the data means, all of it, what types of questions we should ask. So I can give two sort of really concrete examples. One was when we were getting ready to do, and there are many concrete examples, but when we were ready to do the survey, I was really worried because, again, we were getting to that point. It was in March that we were starting to talk about the survey, and we had a surge again in COVID cases across the United States. And I just kept feeling like this is just really not a good time. I don't want to add burden. Maybe we shouldn't do this at all. I mean, I was really sort of thinking, and so I brought it to the advisory because I thought that's my perception as an outsider, but, they know the profession much better. And they were saying, no, absolutely. People are feeling like they really want to talk. And so we should continue to go forward with the interviews, but we might need to be really flexible in when we do them. So it might have to be at night, or it might have to be, over the weekend or sometime. So just preparing us as a research team to be really flexible in offering up opportunities to do interviews, which we of course will. And the other one was in the interview questions themselves. So we drafted the interview questions, and then we sent it out to the advisory board and had a meeting. And we got really amazing comments and feedback about things that we hadn't asked right, or that we hadn't thought to ask, or, and so I think the presence of the advisory is just so critical in our movement forward in a way that's intentional and relevant and helpful. Now, one of the things that was very interesting that the advisory board brought up is, I think we had been moving forward with this idea of as I said, this wasn't research for research's sake. How do we use the data? And we were moving forward with using the data after we do the interviews and the follow-up to develop interventions in partnership with last responders that can provide support in whatever way they think the data is suggesting, in whatever way they think would be helpful for them. But the more we talked about it, and the more we started to realize the intensity of the stigma and discrimination, somebody in the advisory board said, I think there needs to be a second intervention, which is a mass media public intervention that starts to change the narrative and the views of the general public towards this occupational category. So I think now we're moving on those two tracks separately, but of course interconnected. One, thinking about what would a media campaign look like that would change perceptions of last responders, and the other one being something very targeted to the needs of last responders for support whenever they need it, or whatever else they consider to be their biggest needs.
I think the other benefit of the advisory board that we've been capturing a lot of good information is figuring out where the void's at within the survey, and
Yeah.
You've identified a group that what was it, 80-some% were white responders, and
Yeah.
so we're looking at, and with the advisory board's help, and we've been able to really work at getting the cultural diversity of the groups that we're talking to make sure that we have a true understanding of everyone involved in this. And so that type of dialogue in an operational mode really helps, introduces us to groups that maybe were invited for one reason or another, didn't get involved, encourages us now to go back and reconnect with those groups and say, we need you involved in this and be part of this, finding out what we can do to help in the long term for everyone that's been touched.
Yeah, it's super important. I agree.
Uh,
So next week is World Congress 16. What can participants expect outside of going through all the results of your study? What can participants expect from your upcoming presentation?
Well, we're doing two presentations, and so we're doing a general session presentation talking about the philosophy and more of the input of the background of what we have. But I think the workshop session will go into greater detail of what we discussed here. And actually will present the numbers that we have and help, Rima did a great job when you were reporting it to do a solid interpretation of the numbers. And I think that's really going to become critical, because if members of ICISF and their organizations are going to help us as we go to what's the next step after gathering all the information that Rima was just talking about. We're going to need all your help. We're going to need, like Green Cross has, stepped forward with Mary Schoenfeld and other groups have already or serving on our advisory board, saying we need to help get this out, because they know the impact this is having on their communities. And that if we, ICISF has always been a leader in helping identify the groups and helping develop programs to get help out to these different specialties. Like I said, back in 1993, we were talking only police, fire, and emergencies, other emergency services. And that's all broadened out. And so, ICISF are the leaders of innovation, the leaders of helping people network to solve problems. And so what you're going to hear is probably a plea from us to help us. Help us if you have an interest in serving on an advisory board. Reach out to Rima or myself to get on the advisory board if your organization has good resources to bring to the table, and help us make sure that we can in your community reach out to the people in need once we figure out how best to get those resources to them.
Awesome. And we'll be sure to place any additional contact information down in the description below. So that way, if you guys need to reach out to either of them regarding this study or getting additional information, we can we'll certainly leave all of that stuff there. But I'd like to thank both of you for joining us today. Is there anything else that you would like to include or talk about during our discussion today about this important topic of last responders and fatality management workers?
I think we've covered most of it.
Yeah, and just, in your community, just reach out and to your local fatality management workers, say, let them know about what you've learned from this interview, because a lot of them don't know that we're out here in the field working, even though we've tried to reach out. Tell them they're not alone. We had one funeral director yesterday tell us that, she got called to donate a bunch of money to recognize the first responders. And she said, I'm a last responder. Why are you not recognizing us? Oh, we never thought about that. So use your skills as members of ICISF and your connections to help us recognize the last responders, so that we're helping support them to be healthy in the long run, not picking up the broken pieces that so often when our teams are called in, we're trying to reconstruct all these broken pieces and broken lives and minimize the long-term losses that we see so often in the work we do.
Awesome.
Thank you, Kelly.
Of course, yeah. So the ICISF World Congress 16 Wellness Amid Uncertainty is next week. You can join the ICISF community from around the world at ICISF's Virtual World Congress. This real-time live event features over 100 hours of educational content, opportunities to network with presenters and participants in small group settings. We have community-wide network events and so much more. Tomorrow is the last day to register for World Congress 16. You can actually learn more about Peter and Rima's presentation and view other presentations by visiting ICI-SSNSAM, F as in Frank, worldcongress.org. We look forward to seeing you then at World Congress 16 Wellness Amid Uncertainty. Make sure to join ICISF CISM Live Series again in June, where we connect with critical incident stress management subject matter experts live on YouTube. Again, if you've enjoyed the content being shared today, make sure to leave a comment for Peter and Rima down below underneath the description, and subscribe to ICISF's YouTube channel so you don't miss out the next time we go live. On behalf of myself and all of ICISF, I just want to say thank you to all of the last responders and fatality management workers out there. You guys are doing a wonderful job. Keep it up, and we'll see you all next time. Thank you so much.